Okay. Um, Hi, everyone. Welcome to this session on digitization and innovation in civil registration processes. That's our theme, and we are focusing mostly on birth registration. So I'm Lillian Siziba from ECA, supporting ECA on various research initiatives in CRVS. And I'm coordinating this session, this interaction with my colleague. I'll ask them to introduce themselves to you.
Hi, good morning, everyone. Welcome to the session. My name is Joan Thomas, and I'm working with the CART initiative as a mentor and happy to be facilitating with Lillian here today.
Okay, thank you, John. Right, we'll move on to introduce, lined up for this session, for this interaction, 5 presenters whom I'll move on to introduce at once. And then we'll allow them to interact with you through their presentations later. So to start our presentations, we have the first presenter being Mr. Victor Boateng Ousu. Can you show by raising your hand so that the people identify you? Right, Mr. Victor Ousu is a distinguished senior statistician, demographer, and a leader in statistical literacy with over 21 years experience in data analysis and statistical literacy. He has an extensive publication record in this domains and has made significant contributions to Ghana statistical literacy and advocacy and the use of data in decision making and policy formulation. Mr. Ousu occupied the position of District Statistical Officer, leading in the coordination of the 2010 Population and Housing Census and supporting data-driven programs in the district from 2010 to 2014. Currently, Mr. Ousu serves as a senior statistician and officer responsible for education statistics at the Social Statistics Directorate at Ghana Statistical Service. In this capacity, he has been leading implementation of computer-assisted telephone interviewing, CATI, project since 2020, with a notable example including research in the impact of COVID-19 on households and employment. So that's Mr. Victor Ousu. I'll introduce our second speaker. The title of their research is The Impact of Digitization and Service Delivery at Civil Registration Services in Busia County, Kenya. That's Mr. Peter Kennedy Otieno Okothi from Civil Registration Services. Kennedy, can you show by raising your hand? That's Kennedy. Peter Kennedy Otieno Okothi is an assistant director, civil registration, and has worked in civil registration services Kenya since 2008. He is passionate about digitization and digitalization of CRVS and is currently developing a security model for CRVS. Our third presenter, is Mr. Ritu Kuma Mishra, UNDP, sitting next to me. The title of his research is Building Legal Identity from Birth, Good Practices and Digital Innovations in Malawi CRVS System. Mr. Ritu Kuma Mishra is a dedicated monitoring and evaluation specialist with 19 years experience in sustainable development across Asia and Africa. currently serving as an M&E specialist for CRVS and ID at UNDP Malawi. He specializes in M&E frameworks, results-based monitoring, capacity building, and donor reporting. Lined up, next would be the presentation on the impact of digitization on birth registration completeness in Lesotho, a mixed method study. That's the title of the research by Liako Pearl Mokena. Hello, Liako, can you, yes, raise your hand. That's Liako from National Identity and Civil Registry. Liako is a legal professional from Lesotho, currently serving as a civil registration officer in the Department of National Identity and Civil Registry. His work focuses on the legal and governance aspects of civil registration and vital statistics. Liako was part of the first cohort of the CRVS Applied Research Training Initiative, CAT, commonly popularly known as CAT, where she researched the impact of digitization on birth registration completeness in Lesotho, which she will discuss with us for further today. Last but not least, lined on this interaction is Mr. Milton Sengo of Vital Strategies. The title of their research is Integration of SysCov and CRVS in Mozambique, a strategy to expand the coverage and quality of vital registration. Milton is a demographer with a postgraduate degree in public health, currently working at the National Institute of Health of Mozambique as a demography officer. He also coordinates the mortality platform of the National Health Observatory. So that's to introduce our panel. Can we all welcome our panel by putting a round of applause for our presenters? Thank you. So we'll run this session by allowing each of our presenters in the order I've introduced them to present to us their research. Allowing them 15 minutes. They talk to us for about 10 minutes, and then the other 5 minutes, we have questions, if any, from the audience in this room or online. And then we also devote a question and answer session at the end, towards the end of the session, for all the researchers at once. So without taking much time, we'll allow, since we managed to save 5 minutes, we'll get into the first presentation by Victor. Okay.
Thank you very much. Good morning, colleagues. Good morning, moderator and other colleagues online. My name is Victor Watson Owusu with Ghana Statistical Service. The title yeah. Yeah. So the title of my presentation is to look at the impact of digital integration of birth registration rates, a demographic study in Ablekuma West. Ablekuma West is one of the 261 districts in Ghana. Ghana have 16 regions and 261 administrative districts. Why Ablekuma West and why this impact of digital integration? In 2024, March 24th, Ghana launched the digital system where birth registration should be done at the birth. Before I move into the presentation, I would love to acknowledge the hard work of my mentor, Pamela, our key of institution that brought us here, ESA, then ESCAP, and also management of Ghana Statistical Service for giving us the support for me to be here. Looking at the birth registration from right to reality is something that we need to look at. Yesterday in the opening remarks, we got to know that yes, birth, death, and every life matters. And therefore, there's a need for us to register births. How do we do this? One is doing the integration of system. For Ghana to improve on its birth registration, there was the need for us to give birth ID at birth. So this is what we call the registration at birth, which we were not doing. So we do it on paper, but how are we going to integrate it with the National Identification Authority so that at birth you can have your birth card? So we have the unregistered birth, then looking at how the work commitment on the SDG 16.9, where it aims in universal registration, Ghana government its functionality on how best we can accurately measure data for development. If every child is registered, it helps us to formulate policies and develop our civil registration system. That's why this project examines how best we can integrate data from the National Identification Authority, that of the Birth and Death Registry, and our health facilities. Barriers of birth registration, as we all know, in Ghana specifically, move from the regional disparity in terms of lack of awareness and also inconsistency in data integration. And this has been a barrier for the birth registration that we have. And that's why there's a need for us to have this integration of data systems where the birth and death registry system can integrate with the national identification system to ensure that when birth happens at the health facility, a unique number is generated and forwarded to the birth registration office to also issue a certificate. One of the best things that Ghana has done is to develop National Development Plan, which span from 2018 to 2057, and also CRVS Strategic Plan 2025 to 2030. All this is aimed at for us to achieve a universal civil registration coverage. For, as I earlier mentioned, March 14, 2024, the government, in its quest to integrate this system, launched this project. And this was to focus on how best these three institutions, the Ghana Health Service, the Birth and Death Registry, and the National Identification Authority, can have this birth integration system done. Focus of the research is to look at whether this system is actually having impact on birth registration. And that's why the focus on Ablekuma West came to mind and wanted to focus on 2 registration centers in this district. The methods that was used is purely administrative data from these 3 institutions, and to look at before the launch of the digital system, and we have the before and after to look at what has been the impact of this registration. Then I look at the statistical analysis where Stata software is used, and a simple chi-square test was used to identify its whether it's statistically significant. On a simple chart here, where you can see 1, the birth system integration, where we are looking at before and after. So we are looking at 1, March 2023, and March 2024 to October, within the same period, to check whether between March 2023 to October 2023 and March 2024 to October 2024, after the launch of this digital system, what has been the impact of it? Looking at the results on the screen, we realize that before, birth registration was high, after low. That's March when the system was launched. But within July, there was a surge in the birth registration for 2024 after the launch of the system. Then the question is, what might account for this? Is the digital integration having impact on the birth registration in Ablekuma West as a district? And that's where we needed to look at what might account for this kind of fluctuation in the birth registration. We were expecting that with the integration, birth registration need to be high. But at this point, you got to know that no, there's been up and down. So when simple results was done, this table is indicating one, the number of registrations that was done in these two registration centers. That's Dansuman and Gbegbese. These are two registration centers within the district. And we realized that before and after, there were some differences in the registration, which we needed to test. And we got to know that, yes, place of registration has a statistical significance. But when it comes to one, the facility where the registration was done, and then the informant of registration, there was some reduction in the birth registration of these births. That's something that we need to investigate and check whether there were some issues with the integration or there were poor prompts that was sent from the NIA office to the birth registration center. What are the issues that we need to discuss here? In general, the highest reduction in birth registrations were noticeably among the birth registered and attended by the doctors. That's 50% births, and which happened in the clinic or medical centers, about 53%, and maternal homes, about 49%. This tells us that we were expecting more of birth. The birth registration should be increased, but in this case, we experienced some reduction. But when it comes to more of birth registration among those attended by nurses, it almost tripled from the 18 to 52 over the period that we are talking about. That's March 2024 to October 2024. What are my recommendations here? We are looking at one, massive sensitization and education. Without that, it will be very difficult. Is it that the health facility personnel are not aware of this system, or there was not much information or education going to the ground? Our parents were not ready for that. Resource allocation and capacity building. Was these facilities provided the necessary capacity to handle these issues? Who were the target advocates for this campaign? This is what we need to look at. Are we looking at the churches? Are we looking at the traditional leaders or unit committee members who hold the local political system to ensure that they make this system work so that all of us can achieve this birth registration at a larger scale? Cultural sensitive messages are also key, which we need to look at. Why do we need to register our births? Why do we need to integrate our systems? We are looking at one, is the message that we are sending acceptable, and is something culturally the people get the buy-in of it. If we do that, we hope that it will help us to increase the birth registration. Also, the streamlining of registration processes is very key. These three institutions, the National Identification Authority, the health facilities, and birth and birth registry need to sit and also improve on the integration if that's been the costs of the reduction in some birth registrations at these centers. The next steps that we are looking at is further research needs, where we need to investigate reasons why some facilities are not compliant. If that's the case, leading to the reduction in the birth registrations at some points in the month of the year 2024. And also study impact of the urbanization on the registration center, since Dansoman and Begbese is one of the districts recording high urban sprawl. Can it also be the factor where this registration of births are low? Then also assess user experience with Ghana card and birth registration. So here, if majority of us are having the card, children born at the health facility are given the card. What stops us from integrating with the birth registration for them to have their certificate or births registered? If we do all this, it will help us to ensure that CRVS relates its strategies and also the activities within the country to make it work, so that all of us can have, as a country, can have our children registered for better good. Thank you very much.
Okay, thank you, Mr. Victor Ousu. Thank you for keeping your time. I think we have about 2 minutes to take some questions from the audience in this room, and those attending virtually can drop their questions in the chat. Do we have questions for Victor? One or two? I think we can take 2 questions, and then for any other questions for him, you can write them down, and then we can talk about them discuss about them in the question and answer session. So, any questions? Yes, so I would ask you to speak through the mic. You introduce yourself and then you give the question. So 2 questions. So we have you. The other question? The other person? Okay. Only 2. Okay. So I will take, if time permits, I will take William. So it's Mem and then Kasumba. Then if time permits, otherwise, let's note down the questions for Victor.
Hi, I'm Claire Conry-Murray. I'm from the Gender Equity Unit at Johns Hopkins, and I have a question for you about gender. I saw that there is a gender difference in your data, and I wondered, I didn't get to look very closely, but it looked like maybe female births are registered more than male births. Is that right? And if so, what do you think the explanation is for that?
Thank you very much. Yes, it's because of time. That's why some of the data variables were not spoken with. So on the table that I showed, so from table 2, we realized that there were more females registered based on the data picked from the health facility and that of the birth registry compared to that of the male. Yeah.
Any idea why?
So, one, we know that for Ablekuma West, most of these Ablekuma West as a district, which is close to more of the district's business center, where most of the women, Ghana has a more female population, and based on that, knowing that yes, at birth, for us, although male are more at birth, but with Ablekuma West having more females, and this might account for the high registration of females in the district.
I give you the floor.
Yes. Thank you, Victor, for the wonderful presentation. My concern is just around 2 areas. One, on the mandate to notify, which is not coming out clearly. And then the integration. You have talked of the identification You have talked of the birth registration and death registration, but you have not shown us how does the system integrate with the identification. Then on the mandate, I know the Ministry of Health might be having the mandate to notify. So is the integration going with the Ministry of Health Systems, or it is just independent? That is just a clarification I wanted to know. Victor.
Thank you very much. So one, we are looking at the birth registration. And one, we are looking at the launch of Ghana was not practicing issuing an identification number at birth. But on March 14th, this program was launched. And I was looking at what has been the impact of this launch of this project on the impact on birth registration. So here it was between the National Identification Authority and then Birth and Death Registry. These are the two institutions that are mandated to pick our national ID numbers and the birth registry to register births. So the system was in such a way that when births happened, then a unique number needs to be generated for the child, and the prompt is sent to the birth and death registry for a certificate to be issued at birth. So I wanted to look at what has been the impact of this project on the birth registration beyond the launch date. And that, so the system, the mandate of the Ghana Health Service, yes, is to record birth at the facility, but whose mandate is to give the national ID, and that's the National Identification Authority. Whose mandate is to issue the birth certificate? That's the mandate of the Birth and Death Registry. So the integration should be between the NIA and that of the birth registry, with the health service also having the total birth recorded at their facility. But the issue here, as I said in the presentation, looking at the numbers, whether they were not, the birth and death registry was not getting the prompt as the project intended to work. Because if birth happens at the facility, the National Identification Authority officer need to issue a prompt to the birth and death registry when with the number, then this birth registration certificate is issued at birth. Thank you very much.
Okay, thank you for the responses. Let's keep any other questions to the last dedicated Q&A session. I think for now, we move on to our next presenter, who is Mr. Ritu Puma Mishra. Sorry.
No, it's not. Yes.
Yes, sorry.
I mean, pardon.
Okay, so we move on to our next presenter, who is Mr. Peter Kennedy Otieno Okothi. On the title of their research is The Impact of Digitization on Service Delivery at Civil Registration Services in Busia County, Kenya. So I give the floor to you, Peter, to you, Kennedy.
Good morning. My name is Kennedy Otieno from CRS, Kenya. I work in Busia CRS services. My topic is on the impact of digitization of records on service delivery, case of civil registration services, Busia County, Kenya. I want to acknowledge my mentor, Dr. Jean-Claude, ECA and ESCAP for this opportunity to present my work. I also want to acknowledge my employer, CRS Kenya, for the opportunity to be here and present this work. My research, as I had said, is on the impact of digitization on service delivery at CRS Kenya. I'm trying to look at, I'm focusing so much on service delivery. Despite the CRVS process, we have registration, the production of the vital records, statistics, and the certification. So my research is on the impact of the digitization on service delivery. I'm focusing purely on service delivery. When our clients come to the office to get a certificate, how long do they take for them to be served at the office? Then I have a small story here. Imagine you're trying to do a search on Google and also for the word digitization and a search on Oxford Dictionary. Which one will you get the results faster? You'll answer me at the end. Then imagine coming from work and your office or your house, you get that your house has been burnt, or you go to work and you find that your offices have been swept away by floods. Like currently in Kenya, there's flooding, but our CRS offices, they're safe. Then why does this research matter? CRS Busia is located at the border of Kenya and Uganda. And from yesterday's presentation, we have the porous borders. And in Kenya, we register all the births and deaths that occur, despite, even if it's a Ugandan, any foreigner, we register them and we issue them with a birth certificate. So we wanted to test the experience when someone comes to the office to apply for a birth certificate or to do a verification, the experience that they have from our offices. Then my main objective is to describe and evaluate the impact of digitization of records on service delivery, case of civil registration services, Busia County, Kenya. Then the research methods. This study, I adopted a qualitative research design, and I had 2 questionnaires. One questionnaire was for the technical staff, and from the technical staff, I had 29 responses. Then I also had the in-depth interviews with the members of staff of CRS, and I tested six aspects: the system quality, the information quality, the service quality, system use, user satisfaction, and the net benefits. Then I also had another questionnaire for the clients, the registration assistants, that is the chiefs, assistant chiefs, records officers from hospitals, and our clients that seek for services from our offices. From the results from our clients, the table is a bit jumbled, sorry. I tested the service speed, and from the results, from the 231 respondents, around 80% stated that the services are faster as compared to pre-digitization. Then 4.8% claim that the services are still the same, there's no much change. And another 4.8% also stated that the services are very slow. Then the discussion with the technical officers, they affirm that it's very fast to retrieve the records from the system. Then there's also reduced duplication of records. Before, it was very easy for someone to have 3 records from CRS with maybe different date of birth. Someone wanted to change the date of birth to beat the system. Then there's also completeness. The system, when you are doing the data entry, you cannot move. There's some aspects that if you leave, you cannot move to the next phase. So you have to complete. Then there's also centralized storage of the records. Just from my story, we have servers at the back office and also in our headquarters. So from my initial story, when the office is swept away, the records are safe. Then my recommendation is to digitalize the entire system from it's currently being done in Nairobi. Yeah, in Nairobi currently, the CRVS system, the birth aspect, it's complete from registration. From registration from registration to certification up to production of the statistics. It's complete. The death aspect, the death module, it's being worked on. Then infrastructure and connectivity. Currently, when the ISP, the ICT authority internet is down, it's very difficult to connect to the system. So some members of staff proposed offline. If you can do it offline, then when the system is, if you can work offline when the network is up, it just updates. Then also the training and capacity building. It's been long since the staff were trained on the system. Then also the technical staff support. We only have one support desk, which is based in our regional headquarters. Then also the staffing and resources. Then I talked about introduction of the offline functionality. And also decentralization of the system in all CRS offices. All the offices have been, all the sub-counties, currently their offices, and the system is being decentralized in all the offices in Busia County. Then also there's a positive affirmation of digitization by the members of staff, the technical staff that I had discussion with. Then also the community awareness and outreach on just how pre-digitization and post-digitization. We need to inform our members of the percentage that they're not convinced that the services have changed. If we can do an outreach, then when they come to our offices, at least the percentage will increase. Then also the cybersecurity and data protection. Then the future, further research, resilience and disaster recovery, CRVS's resilience and the capability of withstanding cyber attacks, natural disasters, and other disruptive events. Research is needed to develop a robust and resilient strategies. As during the introduction, currently I'm building a model for CRVSS, a security model for CRVSS, as you were told during the introduction. Thank you.
Okay, let's clap for Kennedy. Thank you for the presentation. We still saved some few minutes on his allocated time, so I think we can take one or two questions. For now, if we have more, we can reserve them for the Q&A session. So any questions for Kennedy? Yes, I would ask you to go close to a mic.
Thank you so much for your presentation. Very insightful. I'm Subin Mulmi. I'm from Nationality for All. I'm curious to, you've highlighted all the positive aspects of digitization, and it's undeniable that, digitization makes, things more efficient. But when you ask this question, what is easier, dictionary or Google, right? But there are people probably who don't have access to a phone or a digital device, and for them, they might have to rely on dictionaries. So in those cases for marginalized groups, undocumented groups, there probably could be potential risks of complete digitization as well, right? So they would leave them out. So wanted to sort of hear more on this. What are maybe some potential risks of complete digitization?
Yes, thank you. Back in Kenya, the marginalized group or those who don't have access to internet, we have our registration agents, the chiefs and assistant chiefs, and we also have the teachers. In Kenya, for a child to be admitted in school, he or she must have a birth certificate. So the marginalized groups or those who cannot access the internet, our registration agents, the chiefs and assistant chiefs, and even the teachers, they always assist them to access the system and also to access the services from our offices. Then we also have outreach programs where we go to the community and try and assist them to get the birth certificates and death certificates, and also to do a verification of their records.
Okay, thank you for the response, Kenneth. Right, we have some minutes for one more question. Yes, ma'am. Okay, I'll just take one. I give the floor to you.
Thank you, Ken. This is Pricky Proxy from Uganda. Ken, you talked about registering even us, Ugandans. Yeah, I know you like us so much, but do you put us under Kenyan citizens or Ugandan citizens? I just needed clarification on that.
Thank you, Prexy. Back in Kenya, we register all the births, all the events that occur in Kenya must be registered, and certificates must be issued to all the events that are registered in Kenya. But now on the citizenship, no, we just issue the birth certificate. So you use that birth certificate and you go back with it to your country and get a version of the birth certificate from your country. Yes.
You want to follow up? I think we can give the floor to say, yeah, him. He was the first to raise his hand.
Thank you so much, Victor, for the presentation. Mine is, I don't know whether it's a comment or a question, but I was looking at your findings that digitalization has brought about the efficiency, quick retrieval, and all that. And actually, that's what we expect from digitization. So now what's not coming out clearly is what's really the impact that it brought to Busia, because if you did you compare like before digitalization, after, and maybe the comparison of if there's another county where there's no digitalization has been done, if you compare the two, did you do like that? Because I was trying to look at the paper, I could not see it, but I was wondering that because most of the findings that you have presented is actually what you expect from digitalization. So it's like a confirmatory you were doing. Thank you.
Thank you. Yes, I did pre and post digitization, and I have my paper is here. I have a lot of tables. Maybe we will share and discuss after this.
Okay, thank you. I think if we have any more questions for Kennedy, we can reserve them for the dedicated session for Q&A. For now, we can move to our next speaker, who is Mr. Ritu Mishra, who will speak on building legal identity from birth, good practices and digital innovations in Malawi CRVS system. I give the floor to you, Mr. Ritu Mishra.
Thank you, Lillian. Good morning, everyone. I'm working in Malawi country office, actually, in UNDP supporting National Registration Bureau. And the purpose of showing the map where Malawi is, but my African colleagues will know that from where it is. But most of the times I travel outside Malawi, in immigration I face problem and they ask, where is this country? We never heard. This is the, a small map. It's a very small country with 20 million population. There is a very beautiful lake. It's a beautiful country, very peaceful, although it's a poorest country in the world, but it's a really wonderful country. In terms of acknowledgement, I would like to acknowledge UNICA, Escape, CART, Jean-Claude, who is my supervisor, Bloomberg Philanthropies, and NRB, National Registration Bureau, is the backbone, actually, who is doing the national ID and the CRVS registration. So I'll give you a comprehensive idea the system should work and how the system should look like. I think there is a World Bank institute course on advanced CRVS. So since most of us are working, it's a must-do course so that you understand how the system should be built and how it should be interoperable. There is no question on digitalization also I'll be speaking. So these are just figures. But you can see in the green, how the registration has increased, particularly in hospitals, from 10 to 85% now, and most probably within 2 years you will hear that Malawi achieved universal, registration, achieving SDG 16.9. I'm sure that we'll be completing within 2 years. Yeah, if you see, there are lots of problems. Most of the papers, talk about the late registration, about missed home registration, because there are two components in registration. One is institutional delivery, where registration is very easy if you have a system, but the community deliveries is very complex to record. Then another problem that we are finding in Malawi is over dependency on the donors. Not only Malawi but in many other countries. So the ownership is it's missing. Data privacy and governance, that's another challenge. I think we had the Data Privacy Act in last year, and still we don't have the regulations for the MDAs. Limited desegregated data. So this is another, another problem. Also living, the marginalized community. So basically, I'll be discussing what are the challenges and barriers, to achieve the universal birth registration in Malawi. I won't speak much about the methodology, but in the I think later slide you will get to know that this is a literature review. This is a secondary, this paper is based on the secondary research. Basically, this is a policy paper, so that in future maybe other countries also adopt. So this is the main slide, So first of all, since most of my colleagues, even yesterday as well as today, they said that this belongs to different ministries, different departments. That's the major problem. So till we rectify the legal problem, the legal framework, till we align it properly, we can't do it. We can't make the systems inoperable. For example, the birth registration, the marriage and divorce registration was under Register General of under Register General of Malawi, and then death registration and birth registration was funded by CDC. National ID was funded by UNDP, and did universal registration. So it was very challenging for us how to integrate all these systems, because these systems are different. So birth registration, one database; death registration, another database; marriage registration, another database; and the fourth one is the national ID. So the national ID should be the foundation. So to bring and modify the legal framework, or there are two options actually. Either you make the systems inoperable, because there should be only one unique identifier which goes, which run from the birth till death, including the marriage. You flag everything in the system. So this is most important. The second is electronic birth registration systems. We have been talking about the digitization. So what we have done, we have, introduced the electronic birth registration systems in major hospitals. Now, that's why we are capturing almost 85% of the total births in Malawi. In Malawi, it's interesting that almost 97% of the total births are institutional births. So that's one of the advantages that we have. So in this systems, how the system works, suppose, and the cause of death is also included in the same systems. So we have coordination with Ministry of Health. So once you register a baby in a hospital, automatically that records, as soon as you enter in the systems, it hits the national ID server. So it gets the national ID number. It does the deduplication process. It comes back to the systems after all the approvals. It takes almost like, around 20 to 30 minutes to complete the entire process. After that, since the mother is already there in the hospital, you print the certificate and give it to mother. So, and that certificate works as get pass to go out with a baby. So you can't take a baby from the hospital without a birth certificate. So, it's like mandatory. Also, another important aspect of this system is that we don't manually enter the parent's detail. So we need ID of parents. So we scan the QR code in the system. So as soon as you scan the QR code from the systems, it populates, 50% of the data that is required in the birth certificate. And there is hardly any possibility of a mistake because you are not typing or you are not, transferring from the manual form to this one. So you scan the QR code. So automatically the parent's ID is already there, parents' details is already there, which is linked to the national ID server. And then you can create the family. Suppose you have 5 children under, under one parent. So they all will be recorded and the complete family tree is built. And next is the health integration. I already mentioned, I think, how we are working. Community outreach. So another problem that we faced is like we circulated all the, this hard copy of the forms in the community. And we thought we used to collect, NRB used to collect actually with our assistants and then enter in the office. And then we realized that lots of mistakes. Almost 70% of the total forms collected, we could not print birth certificate because there, some of the things are not legible. There were gross mistakes. Even there were mistakes in the data entry, but these forms were filled by the village head. Then you can imagine, what problems they may have. So for that, we had the last one is like TA, we came up with a solution that we need to digitize a traditional authority. TA is traditional authority, which is consists of 20 to 30 village, so headed by a traditional authority. So we have introduced and piloted this innovative approach where people can go directly and the same system, which is there in the hospital, but slightly different because now we have integrated national ID, birth, marriage, and divorce and death. So anybody, suppose somebody die in the hospital or in this TS systems having the digital systems, the person is entering in hospital, suppose the person is entering the death details. If his ID, first name, last name, marital status, and sex is matching, automatically this data will hit the national ID server and flag that this person is deceased. So that's the beauty of the system. This is the complete ecosystem. That's why I am talking about. Till I am again repeating that till we make, it's a complete system, complete ecosystems, we are not going to, there will be lots of duplicates. So the same systems with the ID we have linked with the with education, now health, and the social benefits also. And that's how, because of all this, we are reaching almost 85% of the total births that is taking place. So in terms of, I think interoperability, definitely we were lacking the Data Protection Act. So now we are working on the regulation for different MDs. So that will be complete soon. We are also planning to roll out the EBRS, electronic birth registration system, across the country. So those, for example, if you are an adult and you don't have a birth certificate, automatically, because all details are there, is it? So automatically the birth certificate is generated and integrated in the mobile wallet that we have developed. So you have like birth certificate as well as national ID together in the system. Causes of the success factor. If you look it, then it's like integration of the birth registration with health services, as well as the Ministry of Local Government, under which the TA and the village head comes. Digital ecosystem. This I talked about. NIN is a national identity number. Actually, at birth, you have to link it with national ID. You have to link with marriage and divorce. Seamless transition to audit identity at the age of when the child, for example, he reaches 16 years of age, he doesn't need anything. He has the birth certificate. He need to visit the NRB office at any place. He give his biometrics, fingerprints and the pictures. He gets the national ID because all details are already there. It's already linked to the national ID systems. Family tree establishment, as I said, Malawi is bordered by Tanzania, Mozambique, and Zambia. So people come, access all the services, benefits. So this is not possible once you create the family tree. Open source software. So we are also thinking of making, because this is the foundational DPI block, okay, digital public infrastructure block for Malawi. So we are planning to make this software as digital public goods so that other countries can also access and use. Yeah, I think now, in terms of the marginalized community, it's very easy for people to access because we are expanding to traditional authority level. Yeah, there are some challenges. I have been mentioning about the data governance issue and working on the working with the MDS because we want to make this interoperable with almost all MDS because this is national ID, the unique identifier. Interoperability, we are still working. There are some ministries and departments where the software is vendor locked. So that's another challenge, So if it is vendor locked, interoperability is impossible. Or, I mean, you have to go by the term and condition of the vendor. Donor risk dependency, I already mentioned this one, and low demand of birth certificate. So as of now, it's we have not achieved 100% universal registration, and I am saying that, assuring you, I am announcing it here that within 2 years it will be universal in Malawi. So I'm sure that we have already discussed with Ministry of Education. We piloted with Ministry of Health. We piloted. This is already linked to the social benefit schemes. This is already linked to Ministry of Agriculture. There is a program called PIPS, Farmers Input Subsidy Program. So it's to a large extent this is working. The national ID is already used by Malawi MAC, Malawi Electoral Commission. And then now I think it's interoperable to a large extent, and there will be high demand soon. Yeah, and recommendation and next step. I have been speaking about these things, so I won't speak more. Data is definitely data governance is required. Interoperability definitely that's I think the top priority. And then enhance financial sustainability. So you have to do the advocacy with the government so that sufficient budget is kept by the government for running the systems. Institutionalize, basically it's health integration I have written, but you have to integrate whatever. For example, in some countries I heard that there are 4 institutions who are doing these things. So CRVS, complete CRVS, you have to work with them. So, and then also further research is required, but I think in terms of the digitalization, we don't need the research. Thank you so much. This is my QR code. You can get in my touch. I have given the email ID also. Thank you.
Thank you very much for the presentation. I think we have time for one question. So the first hand is her. Yeah. So the other questions, let's note them down and reserve them for the Q&A at the end. So I will just take one question.
Okay. Thank you for a very insightful presentation. I just want to notice one thing because it's very impressive increase from 10% in 2000 to 85% in 2025. So it's a 75% of increase on birth registration in Malawi, right? But in your research, desk research, your material, as I noticed, is as old as from 2010. So what I'm suggesting here, maybe you can also put the number, whether how much was that in 2010, in order to, know whether the increase is happened between 2000 and 2010 or 2010 and 2025. And my question is, there is remaining 15% remaining unregistered birth in Malawi. Do you know whether it's concentrated in a certain area or in certain situation? Like, for example, you saw that there is a link between parents and the children, right? So you can use the QR code for the parents. Is it maybe because of that that mechanism, so that people, children born from wedlock parents cannot be registered? So it's just an insight. So thank you.
Yeah, thank you. I was expecting this question because, I wrote like from 2000, it's actually 2000 to 2000. Okay, let me just explain briefly that the National Registration Act came in 2010. So before that, the birth registration was under Registrar General. So that registration act, National Registration Act, that empowered and gave the mandates to National Registration Bureau to register birth and death. Not marriage. Marriage we did later, actually, we modified. Before that, actually, since the birth certificate is not used anywhere, so till 2021, there was, you will see the figure like it's 5%, 6%, 11%, 12%, 15%, and the average is around 10%. Because there was no need for a certificate, why you will get a certificate? So that was the issue. So this issue I actually explained maybe briefly. So the CRVS component, particularly birth and death, was funded by CDC, okay? And then actual registration with these systems started in 2015. And then UNDP came in, and then we decided to start the national ID registration for the adults who were above 16 years of age. So when we started, we did the mass registration and completed 98% of the total population we registered in one go. Seeing the success, then we, the donors came in, and then they requested us to do the birth registration as well. We planned in the meantime. Okay, it's not planning, it's not simple, because you have to, because there is a donor, there is like different things. So you have to like make these two systems interoperable, is it? So we discussed, and we discussed for 3 years. It's very less, by the way. I mean, 3 years to make these two systems interoperable. It's, basically three different databases. So we made it interoperable. I can explain? Okay. So we made it interoperable. The CDC got convinced. They allowed us to come in. Then we started what is called mass registration for the children. So we are doing it now. As we are sitting here, it's going on in Malawi. Okay, I'm getting regular update that what is happening. That's why I'm assuring that this will happen. Yeah, and this, after that we started after 3 years. Yeah, it's 17, 18, 19, 20. Yeah, in the meantime, COVID came, and in 2021, we integrated the systems. Then we tested, and then we roll out, across the hospitals. That's why if you see, like in 2024, 25 onwards, this became like 85, 90% around. So that's how it worked.
That's okay. Thank you for the explanation. I think there is room to interact during breaks and even after 4 during that session devoted for the interactions. Thank you so much, Mr. Ritu. I think we now give the floor to our next presenter, who is Miss Liako Peo Mokena.
Thank you, Lillian. Good morning, colleagues, and the one who are joining us online. Lillian has just introduced me, so may I get straight into the presentation. I'm presenting a paper titled "The Impact of Digitalization on Birth Registration Completeness in Lesotho," and a mixed method study. This slide shows the state of birth registration in Lesotho. Birth registration in Lesotho is mandatory in terms of the laws, but unfortunately, a full coverage has not been achieved. This is due to delays in birth registration, stakeholder collaboration challenges, and limited capacity in terms of technological infrastructure and human capital. The government introduced digital interventions due to this, and it introduced automated CRVS system in 2013, and also automation of birth registration in health facilities and community councils since 2015. And there is also birth e-notification application that it's named Kobo, which was piloted in 2021 and to 2022 and officially launched in 2023. The objective of the study is to assess the effectiveness or the impact of this digitalization intervention and to see the challenge encountered and also what can be done to improve these systems. Methodology. The study employed a mixed method exploratory design where the quantitative component was used to assess the trends of birth registration and the impact of digitalization during the study period of 15 years from 2008 to 2022, where in 2008 to 2012 consists of pre-digitization period and the post-digitization period is 2013 to 2022. Multiple sources were used to compute completeness over the period, wherein estimated published annual population projections of 2006 to 2026 were used as denominators, and completeness rates that were published by Bureau of Statistics Lesotho were also used for the material time of the study. And Lesotho DHS report was also used to calculate completeness of 2022. The qualitative component, primary data was collected where purposive sampling was employed, and selecting the drivers of birth registration in Lesotho, who are civil registration officers, and district managers, who are our registrars. And it should be noted that in Lesotho, there should be 10 civil registration officers and 10 district managers. But unfortunately, due to shortage of staff, the study sample was 12 participants, wherein one declined the interview due to ill health, which made it 11, and comprising of 6 district managers and 5 civil registration officers from 8 districts out of 10. A semi-structured interview guide was developed, which was divided into 4 sections, which one is the challenges and successes of digitalization, legal framework, human capital, and stakeholders' participation. And this guide was used to conduct the key in-depth informants interviews, and thematic analysis was used to inductively generate insights through coding and categorization. Data was also organized into 3 predetermined themes that are challenges, successes, and solutions. And patterns of key observations and expressions were identified and refined using Microsoft Excel. Now the results. This graph here shows the number of projected births and completeness rates by years of occurrence. The blue color shows projected births, and completeness is shown by the orange color. And we know that completeness rate is directly related to birth registration numbers, and therefore their trends are similar. This graph shows no consistent growth or decline in pattern in the rates. So this demonstrates that there was an erratic reporting of births during this period. And however, we note that completeness rates were increased in 2010 to 11.8%, and also in 2015 to 20.2%, and also in 2021 to 60.2%, and 2022 with 66.1%. This slide here shows us the successes of digitalization as reported by the respondents, and this one shows the high level of consensus with improved efficiency and timeliness, and also the increased registration numbers. This one shows the challenges of digitization as also reported by the respondents, and in this one there is a high level of consensus and in challenges like limited internet access and electricity in rural areas, technical system failure, incompetent staff, limited coverage of digitization systems, and use of temporary staff, and resource constraints. This slide here shows us the potential solutions suggested by the respondents. And in this one, the respondents were agreeable on the need to amend the enabling law to encompass digital digital registration, and also to employ trained personal human capacity, permanent human capacity, and also roll out the tablets countrywide and increase public awareness. And here we have our discussion. There has been a significant improvement in birth registration completeness from 2.8% in 2008 to 66.1% in 2022. This shows a better improvement on accessibility and timeliness, coverage, efficiency, and traceability and verification. There was an initial decline in completeness after digitalization was introduced, and this is attributable to strict requirements that were introduced by then, like the need that parents should be registered first. But performance, as time goes, improved significantly after registration services were decentralized in community councils and health facilities. However, some challenges persisted or still remain, including short-term staffing, limited training, and infrastructure constraints. The policy lessons of this study shows that strengthening birth registration systems does not only require digital tools, but also needs well-trained professionals, and also with coordination, a strong coordination, especially with the health sector. And secondly, the community-based approaches also, they are essential to improve notification, especially in the rural areas. Those village health workers and chiefs can significantly improve our notification system. And also, digitalization should be supported by strong legal framework and institutional framework to be effective. And implications for other countries, the digital birth registration is effective when combined with these 4 elements here on the slides: stakeholder coordination, health system integration, strong legal framework, and skilled human resource. The recommendations of the study is that the Enabling Act, that is the Registration of Births and Deaths Act of 1973, should be amended to incorporate digital birth registration, and also should be aligned with Children and Protection and Welfare Act of 2011 to reduce the period of current birth registration from 1 year to 3 months. Yes, and also to strengthen coordination by formalizing roles through MOUs and establishing civil registration committees, both national and district, and also ensuring that key institutions or stakeholders are interoperable, and improving data privacy, sharing, and system integration. Notification should also be strengthened by designating village health workers, chiefs, and other health personnel to be notifiers, and also to use the Kobo notification tablets, especially in the remote areas or rural areas. And also there should be recruitment of permanent CRAs. Those are the ones that are hired on temporary basis now, so that they support the few number of civil registration officers and district managers. And also the community awareness campaigns should be improved or increased. The future research needs to explore other broader stakeholders' perspectives, like health workers and chiefs, and also have to investigate community experience, particularly parents, and also to examine political and administrative factors influencing CRVS reforms, and should explore the impact of COBO e-notification after it has been fully rolled out in the country in all districts, and also that the impact of digitalization on death registration should also be explored. These are my acknowledgements in addition to ESCAP and ECA, and in the interest of time. Thank you.
Thank you, Liako, for the presentation. I open the floor. Do we have anything from the... Okay, those are attending online. Okay, so I'll just take one question from the audience. One question. Oh, we have you. Can you say out your name and your question? I'm only allowing 2-3 minutes
Okay, it will
of
be
the
quick.
conversation.
Yeah, I'm Winida. I'm from BPS Statistics Indonesia. So thank you for the presentation. Can you move to the graph that you showed? The graph. No, no, the other one again. Yeah. This is a very incredible graph, but and as you said that the implementation of digitalization just started in 2013, right? But we saw here there is only 2 significant increase in 2014, 2015, and in 2020 to 2021. And there is even a decline between 2015 to 2020. Maybe you have some explanation regarding this increase only in 2 points of time while the other one were like declining. Thank you.
Thank you very much for the question. I have been, during my presentation, I've been talking about temporary staff. And the reason why I highlighted the number of civil registration officers and district managers is because those are the only permanent staff in the National Identity and Civil Registry Department. So when the contracts of the the assistant or the temporary staff lapses, it means the system it should collapses, and then it will raise again after the contracts have been renewed, or new ones have been employed. So the fluctuation is attributable to that. Yes, as you know, that digital systems, they are just digital tools, but they need human resource to operationalize them. So where there is no human resource, they can't really have any impact.
Is it possible 2014 2015 increase is because it just newly implemented, and 2020 and 2021 is because it was during COVID, so there was a certain law to help people to register their children?
Actually, in 2021, the health facilities were, let me start here. Health facilities were and community councils were automated from 2015, right? And this is where we are talking about a slow improvement from digitization due to the strict requirements which were revised. And then in 2021, health facilities and community councils were automated. Some of them were automated, and then there was this increase. And also during the pilot of COBO application, then we saw the numbers going higher and higher till the 2022.
Okay, thank you.
Thank you.
Thank you for the response, Liako. Thank you for the interaction, Winida. I think we can pursue later. We can pursue during if we still have explanations which we need during the dedicated session. For now, let's give the floor to Milton, Mr. Milton Sengo, who will be our last presenter, but not the least. Over to you, Milton.
Okay, morning everyone. I am Milton. My topic is integration of SysCoV is a community surveillance of mortality, and the CRVS in Mozambique. It's a strategy to improve coverage and the quality of vital decision. And this is my acknowledgement. I usually avoid managing individual names to ensure I don't intentionally leave anyone out. So beyond the institution acknowledgement here, I would like to thank everyone here. And if you allow me, I would even prefer to speak in Portuguese to trial shine here. Wide service meta ensure legal identify for all SDG 6.9 to support evidence-based health planning and enables SDG monitoring. The challenge in Mozambique is a low death registration between 29% and 46%. Weak interoperability between system, delay to reporting, the limited data completeness, timeline, and use. The strategy opportunity to integration of community surveillance and SRServ system, SRServ service system. Strategy it's linking community data to national service and improving the coverage, timelines, and quality data. The objective is to assess how integration strategies to service performances in Mozambique. A community-based system example, the capture have 50,000 and BEF and 20,000 BEF to 2019 and 2022 that I are not full reflect in the official CRVS system. The integrating this data can significantly to improve completeness, especially in a rural area. We know that Africa is a practically rural country or rural continent. The research method is a documentary, descriptive, and quantitative study based on national data 2018 and 2024. Focus is SysCoV and the CRVS integration. I approach data flowing mapping community and national level, identification of gap and bluff nicks, and the reconstruction of the integration pathway. A key component is a digital interoperability and the verbal autopsy and integration, capacity building, monitoring using key indicators. Data analysis is data SysCoV and a SysServ system, it's a CRVS system, and they analyze data in the code coverage, completeness, consistency, and the timeline. We use it here data to assess how SysCoV CRVS integration improves performance, interoperability, community surveillance, and the digital system. This is a few results. Example, beef registration to reflect improved health service coordination driven by digital integration in the institutional collaboration to stronger gains after 2021 linked to SysCoV integration to starting by verbal autopsy. This integration to contribute to significant improvement of both and beef and the death registration, especially after 2021. Their system become a faster, larger, and stronger with a reduced delay, expanded coverage, and increased capacity. To reducing 67, reducing the reporting delay, and human resource capacity to 100 increase that use more integrated report for more real time in the dashboard. My discussion is alignment with global evidence. Mozambique follows global trends where digital integration improves CRVS performance. Interoperability between health and the civil research is a key driver of the system something consistent with international experience. We have here the Rwanda example, integration with immunization system and improve, and the tracking and the resistance efficiently. Example, Bangladesh up to again is of digital CRVS. Mozambique's experience confirm the integrating community base with CRVS aligned with global evidence in the strategic system performance. Recommendation, scale integration to expand SysCoV and SIR7 interoperability to all provinces and districts of the country. The priority is high burden to understand areas to ensure equitable national coverage, to invest connective hardware and the system reliability and support to transition from the paper-based to full digital system, ensure source and interoperability data. Build the sustainable human capacity, and then scale integration to expand. No, this is too big. This is my list. Thank you for all. Yes.
Okay, thank
I
you.
saved the time.
Okay, yeah, you
Yes,
saved
because
us.
I'm saved the time because during the question that follow anything I don't clarify, we can discuss in the formally in the afterward because my English is very less.
Okay, thank
I want
you.
to go.
Thank you, thank you, thank you. Okay, he asked for questions in the later, but I think we can take one or two if we have directly for him now.
No, I said that we
Oh, in Portuguese. Okay. Okay, thank you. I think he saved us much time. Thank you. Let's clap for our presenters, right? Thank you all for such interesting presentations. We now open the floor. Maybe we can start with the questions. If we have questions on the from those attending virtually. If we don't, I think we can, so that we don't overwhelm our presenters, I can suggest that we start with a round of, each round can have 4 questions, and then we have them answer. We go to another round and we see how our last 30 minutes of the session fare. So 4 questions. So I'll have 1, 2, in that order, 1, 2, 3, 4 for now, for this session. And then, so say out your name and then the question you direct to your, the presenters whom you want to respond. And then just, I think we can stick to a maximum of 2 from one person.
Okay.
Yeah.
Thank you, Lillian. Good morning, colleagues. My name is Scholastica Kinge. I work with Kenya National Bureau of Statistics. So I don't know if it's a question or a comment to the Malawi presentation, because Malawi is also one of the NSOs that I love working with. And I was just browsing through to check if there's any reports on their vital statistics, because evidence-based decision making, there's nothing public on the vital statistics, but the UN and donors are able to pump in money, but we are not seeing the output for it. So it's encouraging to see events 97% of the events are occurring in a health facility. But then again, we are not seeing this. It's only those people within the country who are able to see that. So if, on behalf of the Malawi National Statistics Office, as you're supporting the Registration Bureau to improve the system and service delivery, please help them develop a vital statistics report. Thank you.
Okay, let's take the next question. So let's have all our questions, the 4 questions for this round, and then they will take turns to respond, our presenters.
Sure.
Next question.
May I?
Yes, yes. You.
Okay, thank you. I want to ask to the first. Oh yeah, my name is Raja. I am from BPS Statistics Indonesia. I want to ask to the first presenter, Mr. Victor from Ghana. Thank you for the presentation. I just want to clarify about your content at the presentation for the results part, the graph. Is this the same with the graph at the discussion? Because when I look at the discussion, the title is the graph of the birth registration in 2023 and 2024. And at the results, also the same. Is this the same thing or not? Maybe you can give the clarification to me. Thank you.
Okay, thank you for the question. Yes, you can shoot your question. Yes, sir. Yeah, you can lay out your question.
Thank you very much, all the presenters, for the beautiful presentations. My question, I'm Dipesh Shrestha from Nepal. My question is to Mr. Mishra. You mentioned that the donor funding has been one of the challenges in as a sustainability risk in Malawi. So my question is, being based on your experience working in Malawi, what can actually the government do to address the situation, to address the sustainability risk? And my second question is to Advocate Liako. My question is, are you recommending for a separate act to regulate the digitalized birth registration system, or just to amend the existing act? Thank you very much.
Let's have the last question for this round, and then the other questions, we'll take them later. Okay.
Okay, very great presentations from all the presenters. I'm Yukta from India. My question is for Dr. Ritu. As you have mentioned, like I am just curious to know, as you have mentioned that while registration, the parents have to bring their IDs and scan the IDs, and the family tree is been developed. What if there are parents who don't have the IDs? First question is this: what are the challenges regarding this? And is this a challenge why the 85%, why there is 15% gap? Is this somewhere associated with the both of these things is the question.
Okay, thank you for the questions. Now to the presenters, we can take turns to respond. We have questions for Ritu, I think three people, Victor and Liako. So we can ask who would want to go first? Okay, Victor, so you can respond.
Thank you very much for your question. Yeah, so the study was within 2 periods, 2023 from March to October and 2024 March to October. The reason being that we're looking at before and after birth registration at birth using the national ID. So that's what we wanted to compare. Before the launch of this integration of data, what was the situation? And after the launch, what has been the situation of the birth registration at birth? Thank you. So there's 2-year difference with the same period, March to October.
Okay, thank you for that response. We give the floor to Liako.
Thank you for the question, my learned friend. The recommendation is that the act should be amended because it is too outdated. It's outdated as it says 1973 Act to incorporate the digital innovations of years so that at least we go for paperless birth registration and digital birth registration. For now, we are wasting time because it looks like they coexist. For example, when you use a tablet, you still have to fill in the form because the form is recognized by the law when you can't go totally digital. Thank you.
Thank you, Liako, for the response. Now we give the floor to Ritu.
Yeah, thank you, Kolastika. It's interesting, you know, because the mandate of publishing any data in Malawi is with NSO. So NRB can't publish any data. But interestingly, as I mentioned earlier, there is no regulation as of now. You know, we are working on the regulation that how the data will be shared within the MDs. Till now, it's like very informal and you know, it's not up to the mark. Also, you know, the capacity of NSO in publishing and analyzing the data. So that's another component. But together with this, we have come up with a website for NRB. It's you can find, I think it's uploaded, it's up and running now for NRB, where you will find all the reports. So together with this one, including the CRVS report, which we printed last time, we just assisted in printing because there were other players, so they requested for us to print. So the reports, you will find the first reports from NRB. Together with this website, there is an inbuilt component of AI because you know. So how the AI works, suppose a district commissioner in a district, remote districts wants immediately data, you know, how many children are there below 1 year, is it? So he will just write casually the way we write in any AI. He will just write that, okay, I want to know that how many children in this districts are there, you know, below 1 or maybe below 5 or maybe below 10. So that's another innovative component that we have added. Coming to my Nepali friend, yeah, this is very, very challenging because you know how to get rid of the donors' dependency. So because the government won't put money till they understand the importance of registration, is it? And registration as a comprehensive ecosystem. It's not only you are registering marriage and you want money. So to make this understand, we have come up with a revenue model, a revenue generation model. So there are two components of it. One is direct cost. One is direct revenue generation, and the other is cost saving by government because of this registration, how much the government is saving. Because this is a comprehensive system, the unique ID. So you have to think about the unique ID. For example, this is being used in multiple things. For example, just Malawi Electoral Commission, they saved a lot because earlier the make ID used to print in Dubai, come in, you need to bring them. You have to do the voter registration prior to printing the IDs. So voter registration used to take lots of time, lots of duplicate. You can register in this district, in another districts as well. So that component has gone, and then we have built a very nice revenue model. Building the World Bank, there is a document actually how you can melt, like how you will be removing the ghost workers from the civil service, how we'll be removing the impersonation. So I mean there are lots of models actually. So using that model, we have come up and submitted to government, and then government is increasing the budget. To my Indian sister, she asked about people without ID. So what we do? Yeah, so this was a major problem, if parents don't have ID. In 2025 election, we registered 7 million people for registration, okay, for voter registration. Out of 7 million, 2 million don't have ID because they lost, they damaged, they never received. There are a chunk of, population, is it? So what them? I mean, you can't say that you don't have ID, you can't vote. So now what we are doing, we have come up with something called digitally signed biometrics QR code. Okay. digitally signed biometric. That means in the QR code, there is biometrics also, the picture of the person as well as the finger. Or one, the best finger out of the 10. So suppose if the parents don't have, and then I am parent because I went, maybe it was urgent delivery, I went to hospital and I don't have. So you give your details, for example, the village name, the districts, your name, first name, last name, search in the systems. Immediately you generate a small QR code. We have thermal printer, so it's you scan that code. So scanning and linking the parent's ID becomes super easy, not only for this birth registration, but for other activities also, like as I mentioned in social benefit schemes. Thank you.
Okay, thank you for the responses. Now I think we can take another round of questions if we have. Yeah, there was one question here, another one there, 2, 3. Okay, so we can start from here.
Thank you. Give me the dais. I'm Husnara Parveen. I'm working at the Ministry of the Health and Family Welfare at Bangladesh. I enjoy nice presentation of all. My question to Mr. Ritu. Do you have any edit option to take when a child was born and he continue after proceed, such as when a child was born at hospital, usually he or she has no name, but you do the registration, what the procedure proceed, then other. And in case of the home delivery, what procedure in the Malay you do for further take registration or any other process? My question. And the second, the impact of the digitalization in Lesotho, am I wrong? Mo kina, yeah. The question, when you display the graph, you please show that. Yeah. First graph. Yeah. First graph. No, previous. Yes. Here, from 2020 to 2021, 17.7 to 16.2. Is it, what is the contributing factor? Here, the digitalization include the numbering of the reporting or include the area of the reporting? I want to know that.
Okay, she will respond. Okay, let's take the next question.
Okay, thank you for the opportunity to ask questions. First, I want to thank all the presenters because those that presented here are very new in the area of CRVS world. Like they are doing digitalization, they are covering the whole country, they are improving very well. First, I want to ask a question to my friend Ritu, that you told you were going to, after 16 years, when a birth registration is done, then after 16 years, he or she can go to any place, any NRB center, and put biometric. And the thing is that when they go to biometric center and put their biometric, do they need to pay something or is it completely free? Number one. And number two, particularly I am focusing on sustainability. Like what we feel as I work in, I forgot to mention myself. I am Mohammad Rafiul Hassan. I am from Bangladesh and I work at the Ministry of Health. As I work with the Ministry of Health, what we face every day, that whenever the funding is over and the program falls. So the main thing is sustainability to me. And then what's your plan for the sustainability of the system? Because when UNDP funding is over, how it will work? Thank you.
Thank you for the question. I think we can take 2 more questions for this round. So over there and then, okay.
Okay, thank you. My name is Estiana. I'm from Indonesia. Thank you for the all speakers for the insightful presentation. And my question is for Miss Liako. Just wondering about one thing that about that diagram too. In that diagram, the projected birth at 2022 is decreased significantly. I want to ask why. There is different methods to fund the projection or anything else, because it could possibly affect the increase in completeness in that year. Thank you.
Okay,
Sorry, Lilian, I didn't get the question well. Maybe you can clarify.
Oh, okay.
Thank you.
Would you care to come again with the question?
Yeah, I want to ask why the birth projected in 2022 decreased significantly from previous years. Yeah, because it could possibly affect the increase in completeness rate.
Okay, so its total number of births in 2022 have decreased significantly. Why? Let's take the last question for this round.
Yeah, good morning to everyone. My name is Kit from Ministry of Health, Lao PDR. And thank you very much for the presenters. This is very informative presentations. And I found that we have a lot of technical capacity in terms of many issues that you have presented, birth registrations, death registration, and many others. But for any presenters, I want to share a little bit experience during my work is that this work should be taking or increased accountability of the governments. So National Statistic Bureau cannot achieve this work alone. It cannot be complete by Ministry of Health or National Statistic Bureau. But what is the role of multi-sectoral collaboration like line ministry? So we found that sometimes from the top, from the national level, we have a very good technical capacity like you have presented, but at subnational level, there should be increased local authority accountability, for example, ownership and leadership, like a provincial governor or district governor, community leader, for example, to put more effort to do this work. What do you think in your context? Thank you.
Okay, thank you for those questions. So I think we have we have questions for Ritu, directed to Ritu, Liako, and then the last question was directed to any, we can say all presenters if we are in a position to respond to that. So we can give who first? Liako and Ritu. Oh, okay. Let's have Ritu respond to your questions first, and then we have Liako, and then we open to this one, which was directed to all of you. So, Ritu.
Yeah, thank you, Parvin. You had two questions. One is edit option. The other one is on home delivery, what we do. So there are two components of, edit in birth certificate. Definitely. I mean, suppose, somebody is giving birth in hospital and they suppose, the mother has given a name, but when he reach or she reach home, then the grandfather or mother will say, no, this is not the correct name, that you changed the name. So till 2 months, the name change is free of cost. So the parents can come and then just change the name. So that's one process for name change. After 2 months, if they want to change the name, there is a act, it's called Name Change Act, so they have to follow that process. So they have to request, they have to court, visit the courts like that. I think it's clear. Okay, sorry, on home delivery process, So in Malawi, if you Google, you will find that interestingly, 97% of the total birth tax are institutional delivery. Okay, so that's one of the beautiful thing. That's why we are achieving that much. Rest 3%. We had the village head as the legal registrant in Malawi, but now since they used to fill up manually, so we are introducing tablets. It's a biometric tablet actually having everything, not only birth, because I said you need to scan the QR code of the parents. So having everything, we are introducing it across the country. So in 5 districts, 87 locations already done. So rest of the year will be done in this year. It's like total 450 we are targeting. So that will solve everything, all the problem. Coming to Rafael's problem regarding the sustainability, that's a major issue in most of the developing countries, is it? We don't have that much money. UNDP also, or World Bank, or ESCAPE, or NSO, anybody can't fund, continuously. So the cost of ID printing is almost like $3, okay? And it will go much higher after this geopolitical instability, I think, because the cost of chip is going up. So because of that, we have come up with something called multiple credentials, okay? It's not only the physical ID, but you can have digitally signed biometrics QR code, which exactly works how the chips work, ID works. So you can just scan, you can do verification. As soon as you scan, this is linked to the server. And then there is online as well as offline verification method, okay? So this is like one component. The first is physical ID. The second is biometrically signed, digitally signed biometric QR code. The third option that we have is ID in mobile wallet. Okay, so you are registered, you get a link, you click the link, you verify that you are the same person, you do the liveliness check by shaking your head like this, you smile, then it's verified, you download your document. So these are the definitely funding can't be permanent. In addition to this multiple credentials, we are also working on removing the expiry date from the ID. In the last state two, there is something called SONA. State, it's an address by the president. So in the last address of the president already, we are doing actually advocacy. So president already announced about the removal of the expiry date from the ID. Thank you, Rafael. Now, I think on capacity building at subnational level, just 1 minute, I think that was a general question. Yeah, that's essential, I think, So our role as UNDP or as UN, it's not only, building something and then it finishes as we close the project. So it should be sustainable. So on all the components, whatever we are doing, it's like super sustainable. For example, we have another component on digital literacy, in which we have done an agreement with the Microsoft and Cisco Network Academy for digital literacy courses, all these like very general to very high level courses. And then we are working on the sustainability of that platform also. What happens, once we close the project. So we are building the capacity at subnational, national level, at all levels, so that they can sustain the project. Thank you so much.
Thank you, Ritu. We can have Leah corresponding.
Okay, thank you. I will ask the last question. I fully agree that CRVS strategy require the strong multi-sectorial collaboration. No single institution can do it alone, but it involves health statistics, civil registration, and the local authorities. But while technical capacity exists, the main challenge is strengthening ownership at the local levels, including the provincial and the community leadership. From our experience in Mozambique, even within the collaboration, there can a fragmentation. when to start the community surveillance, we are working closely as a two institution, but over time we diverged. Fortunately, with the support of the vital strategy, we are now reconnecting the interoperability with CRVS, with surveillance community, which is helping to align the offers and improve the result.
Okay, thank you, Milton, for the response. We give the floor to Liako.
Thank you. The 2022 difference, yes, you are correct. The projected number of deaths in 2022, they didn't use the statistics. Bureau of Statistics did not use the projected annual. Yeah, what is the projected population, the annual population projections of 2006 to 2026. They used the LDHS report, which they normally do after 5 years after census to update the census statistics. That is why the difference comes from. Yeah. And I think I highlighted that in the presentation. For the contributory factors to 2020 completeness rates, COVID-19, of course, affected the registration process. And also when it picks up, the completeness rates picks up is due to deployment of civil registration assistants, the temporary ones, and in health facilities, community councils, and also they were doing door-to-door this time, and also the COBO notification. Thank you.
Okay, thank you. We can give the floor to Victor.
Thank you very much. So I agree with you on the last question. NSO cannot do it all. So in Ghana, what we did was, yes, the Ghana Statistical Service is coordinating the national statistical system and bringing all the data producers together. So in the year 2023, Ghana Statistical Service, through the partnership with Denmark, took 7 institutions to Denmark to understudy how their CRVS system and how their data is well integrated. So the National Identification Authority, Ghana Immigration Service, Ghana Health Service, Ministry of Health, Birth and Death Registry, and then Integrated Management Information System is also a partner to National Identification Authority. And then the local government authority, this supervises the local district level activity when it comes to data production. So the idea was to bring all these institutions together, sit on a table and see how best we can develop one data pipeline so that all this integration can help. And under the Harmonizing Improving Statistics in West Africa project, a facility that the World Bank gave to Ghana, we tried to digitalize all the data producers platform. So Birth and Death Registry, their system is well digitalized and is being integrated with a National Identification Authority. Ghana Statistical Service is also working with Birth and Death Registry to see how best we can get access to the data from them to inform policies by developing regular report and statistical data for the local government to implement. So these are the activities that we are doing to ensure that one entity cannot lead this CRVS system. We need that collaborative system so that we can strengthen the entire ecosystem. Thank you very much.
Okay, thank you, Victor, for the response. I think checking on the clock, it's exactly 12 o'clock, and I don't want us to eat into the lunch hour. So I would like to take this opportunity to ask all of us to clap hands for ourselves. the presenters. We have been engaging us, and we have devoted these 2 hours to this interaction. Like it has always been said, we are not cutting the opportunity to interact more or ask more on a particular research. The papers are posted online. For those who are attending online, I think you can get the contacts as well. So let's interact, let's engage more. Thank you. Attention today. I close this session. Thank you.